Hello, and welcome back to our video series on pharmacology for health professionals. In this video, we will continue our course with chapter number 11, cardiovascular drugs. Learning objectives for this chapter: compare and contrast the therapeutic effect of beta blocker drugs versus calcium channel blockers versus ACE inhibitor drugs. Name 5 different diseases that propranolol is used to treat. Compare and contrast the therapeutic effect of bile acid sequestrant drugs versus statin drugs. List 3 ways in which digitalis toxicity can be treated. Describe the therapeutic effect of nitrate drugs. When given the name of a well-known cardiovascular generic drug, identify the trade name. When given the generic and trade names of a cardiovascular drug, identify what drug category it belongs to and what disease it's used to treat. When given a cardiovascular drug category, identify several generic and trade name drugs that fall in that category. When given an ending common to several generic drugs, identify the related drug category. And lastly, identify keywords and phrases for this chapter. First, we'll start off with drugs that are used to treat hypertension. Hypertension, which is usually abbreviated HTN, is characterized by an increase in the systolic pressure or an increase in the diastolic pressure. And this can be caused by several things, including arterial sclerosis, kidney disease, and any number of other kinds of diseases. Now, hypertension may also have no identified cause, such as in essential hypertension. Now, normal blood pressure should be lower than 120/80 millimeters of mercury. So getting higher than this is what is hypertension. Now, there's a stage prior to hypertension called pre-hypertension. This is where you have a systolic blood pressure that's between 120 and 139 millimeters of mercury, or having a diastolic pressure between 80 to 89 millimeters of mercury. Then the pressure gets higher than those readings, that's when you have hypertension. So where the systolic is over 139 millimeters of mercury, or if the diastolic is above 89 millimeters of mercury. Now, if left untreated, hypertension can cause damage to the heart, to the blood vessels, the kidneys, and multiple other organs. The treatment for hypertension follows what's known as a stepped care approach. And the first step in this approach is changes in the patient's lifestyle. The patients are asked to restrict the amount of salt they use in their diet. They may be asked to go on a low salt diet by the physician. They may be asked to exercise more, may be asked to lose weight, stop smoking. So all these are the initial steps in the stepped care approach. Now, if the high blood pressure can't be controlled with these initial steps, then drugs are added to the treatment regimen. Type of drug that is often given for hypertension are diuretics. Now, diuretics are given to promote the excretion of sodium and water within the urine. And by eliminating both of these, you are going to decrease the total blood volume. So if there's less volume for the heart to pump around, the heart doesn't have to pump as hard. So this will lower blood pressure. Another type of drug that's used for hypertension are alpha-1 blocker drugs. And these are receptors that are located within arteries and veins. And these cause the blood vessels to dilate, which will lower blood pressure. These are some examples of this type of drug: doxazosin, which is sold under the trade name Cardora; prazosin, sold under the name Minipress; terazosin, sold under the name Hytrin. And you can see the endings for all 3 of these are the same, the Z-O-S-I-N. Another class of drugs that's used to treat hypertension are beta blockers. And these drugs work because they block the action of epinephrine at all beta receptors. So this will decrease the heart rate and also dilate the blood vessels. And both of these effects lower blood pressure. There are many examples of beta blockers that are used for hypertension. Some examples here: acebutolol, sold under the name Sectrol; atenolol, sold under the name Tenormin; betaxolol, sold under the trade name Curlone; bisoprolol, sold under the name Zebeda; cartiolol, sold under the trade name Cartrol; metoprolol, sold under the names Toprol or Lopressor; and nadolol, sold under the name Corgard. Other examples of beta blockers: nebivolol, sold under the name Bistolic; pembutolol, sold under the name Levotrol; pendolol, sold under the name Viscan; propranolol, which is one we'll talk about a little bit more here in a few minutes, sold under the name Inderol; and timolol, sold under the name Blocadrin. All right, now we'll talk about a drug alert, a little bit more detail about beta blockers. So in patients with hypertension, beta blocker drugs block the action of epinephrine on the beta receptors, and this will act by slowing the heart rate and also by dilating dilating blood vessels. And both of these actions decrease blood pressure. Now, beta blocker drugs block all beta 1 and beta 2 receptors. Now, drugs that are cardioselective beta blocker drugs are more selective in their action by only blocking beta 1 receptors in the heart and beta 2 receptors in the blood vessels, but not in the bronchi. Beta receptors are protein molecules that are located on the cell membranes of myocardial cells in the heart and the smooth muscle cells within the blood vessels and in bronchioles. So all beta receptors are stimulated by the hormone epinephrine, and this is in response to the fight or flight response caused by the sympathetic nervous system. When beta 1 receptors in the heart are stimulated, this causes them to increase the heart rate. When beta 2 receptors in blood vessels are stimulated, they cause the blood vessels to constrict. And both of these actions will end up raising blood pressure. When beta 2 receptors in the smooth muscle of the bronchi are stimulated, they cause the bronchi to relax, which will increase the airflow to the lungs. Now, this is why cardioselective beta blockers are used. So in this type of situation, you don't want to block the beta 2 receptors in the bronchi. You want them to be stimulated so there's more airflow going to the lungs. Now, several beta blocker drugs, such as atenolol, metoprolol, nadolol, and propranolol, and timolol, are prescribed to prevent migraine headaches. Now, these drugs act on beta receptors in blood vessels in the brain to limit the tendency of the vessels to overdilate during a migraine. Also, several types of beta blockers are prescribed to treat performance anxiety, such as stage fright. So some professional musicians and actors and golfers will use beta blocker drugs to block the effect of excess epinephrine, such as having a dry mouth or having tremors, having cold extremities or gastrointestinal upset, the inability to concentrate, which impairs their ability to perform. So these are taken to help dial back the effects of epinephrine. So the other class of drugs that you'll see that treats hypertension are alpha and beta blocker drugs in combination with one another. So regarding the smooth muscle of blood vessels, these drugs will block both the alpha receptors and both beta 1 and beta 2 receptors. And examples of this kind of drug are carvedilol, known under the trade name Coreg, and also labetalol, sold under the names Trandate and Normidine. The other category of drugs that treats hypertension are calcium channel blockers, and these act by blocking the movement of calcium ions into the heart muscle and into the smooth muscle of the blood vessels. And by blocking the flow of calcium to these tissues, you're going to decrease the heart rate, you're going to dilate arteries, which will eventually lower blood pressure. Some examples of calcium channel blockers: amlodipine, which is also known as Norvasc; clevidipine, sold under the name Cleviprex; diltiazem, which is sold under the name Cardizem; felodipine, and also isradipine, sold under the trade name Dynacirc. Other examples of calcium channel blockers: nicardipine, sold under the name Cardine; nifedipine, sold under the trade names Procardia or Adalat CC; nisoldipine, sold under the name Sular; and verapamil, sold under the names Covera HS and Kalen. All right, now we'll talk a little bit more in depth about how calcium channel blockers actually work. Now, the pumping contraction of the heart muscle, as well as the contractions of smooth muscle and blood vessels, depends on the flow of calcium ions from outside to inside of each cell. Now, these calcium ions move into the cell through calcium channels. They're located within the cell membranes. Calcium channel blocker drugs prevent the movement of this calcium into the cell. With less calcium inside of the cell, it contracts less strongly and also less often. This causes the blood vessels to dilate, and then the heart muscle will contract less forcefully and less frequently. And both of these actions will end up decreasing blood pressure. Another type of drug that's used to treat hypertension are ACE inhibitor drugs. The letters ACE stands for angiotensin converting enzyme. Now, this is an enzyme that will convert angiotensin 1 into angiotensin 2. So if angiotensin 2 is not produced, the blood vessels will end up dilating, so which is what you want for hypertension. Some examples of ACE inhibitor drugs: benazepril, also sold as Lotensin; captopril, also known as Capitan; enalapril, sold under the name Vasitec; and fosinapril, sold under the name Monopril. More examples of ACE inhibitors: lisinopril, sold under the names Prevnavil or Listril; moixapril, sold under the trade name Univasc; perindopril, sold under the trade name Acion; quinapril, sold under the name Acupril; ramipril, sold under the name Altace; and trandolapril, which is sold under the name Mavic. I now talk a little bit more in depth on ACE inhibitors and how they work. Now, the body has its own natural blood pressure regulating system. So, in response to a low blood pressure, the kidneys will secrete a hormone called renin, which helps to produce angiotensin 1. Now, normally, angiotensin 1 is relatively inactive, but when it's acted on by angiotensin converting enzyme, or ACE, it is converted into angiotensin 2, which is a very strong vasoconstrictor, which will end up raising blood pressure. Now, ACE inhibitor drugs prevent angiotensin converting enzyme from changing angiotensin 1 into angiotensin 2. Now, angiotensin 2 receptor blocker drugs prevent angiotensin 2 from binding to or activating receptors on the smooth muscle of the blood vessels. So both ACE inhibitor drugs and angiotensin 2 receptor blocker drugs have a black box warning on them because they can cause fetal death if taken by women who are pregnant. Another category of drugs that's used to treat hypertension, one we just mentioned, angiotensin 2 receptor blockers. These will prevent angiotensin 2 from binding to and activating receptors on cells. So this will allow for the smooth muscle to dilate, which will cause the blood pressure to decrease. Some examples of angiotensin 2 receptor blocker drugs: azilsartan, sold under the trade name Ederbi; candesartan, also known as Atacand; eprosartan, sold under the name Tevitin; irbesartan, also known as Avapro; losartan, known as Cozar; olmesartan, known as Benicar; telmisartan, known as Myocardial; valsartan, also known as Diovan. Another category of drugs used to treat hypertension are renin inhibitor drugs. And these act by blocking the renin from being produced in the kidneys. By doing so, less angiotensin 1 is produced, which means it can be converted into angiotensin 2. So this will cause the smooth muscle and the blood vessels to dilate and lower blood pressure. An example of a renin inhibitor drug would be aliskiren, which is sold under the name Tecturna. In this image we have an example of a bottle of Tecturna. It's the only drug in this category, renin inhibitor drugs. Another class of drugs used to treat hypertension are selective aldosterone receptor antagonist drugs. Now, aldosterone is a hormone that is produced by the cortex region of the adrenal glands, and these work by increasing the reabsorption of sodium from the kidney tubules back into the blood. So as sodium moves back into the blood, it brings with it water through the process of osmosis, and this action will increase blood pressure. So an example of a selective aldosterone receptor antagonist drug would be eplerenone, which is sold under the name Inspra. And this works by blocking the action of aldosterone. Another type of drug used for hypertension are peripheral vasodilator drugs. These act by relaxing the smooth muscle within the blood vessels, which causes them to dilate, end up decreasing blood pressure. Some examples here: hydralazine, also known by the name aprezoline, and minoxidil. Now a quick focus on healthcare. Minoxidil is also marketed under the trade name Rogaine, and is used to treat thinning hair and baldness in men and women. This is applied topically to the scalp, and its vasodilator effects helps to reestablish blood flow to the hair follicles, which ends up resulting in new hair growth. See other drugs for hypertension. These drugs will help stimulate the alpha-2 receptors in the vasomotor center of the brain, and these act by decreasing the number of nerve impulses sent by the sympathetic nervous system to the adrenal medulla, which will therefore secrete less epinephrine. This will cause the heart rate to go down and allow the blood vessels to dilate, and all of which will end up lowering blood pressure. Some examples of this kind of drug: clonidine, known as Pectoris; guanabens, known as Witensin; and guanfacine, which is sold under the trade name Tenex. And because hypertension is so prevalent, it's very common to see combination drugs used to treat it. There are multiple types of combination drugs. One combination you could have is a antihypertensive drug that's combined with a diuretic drug. Other drugs you may find are beta blockers, including atenolol, metoprolol, propranolol. You can see ACE inhibitor drugs used, such as benazepril, enalapril, lisinopril, lisinopril, quinapril, trandolapril. Other combinations may include calcium channel blockers, such as felodipine or verapamil. You could also see angiotensin 2 receptor blocker drugs used, candesartan, irbesartan, losartan, for examples. You could also see telmisartan, valsartan as other examples of angiotensin 2 receptor blockers. You can see the renin inhibitor drug aliskiren. You may have a diuretic drug used, such as chlorthalidone or hydrochlorothiazide. Some examples of combination drugs that are used: Acuretic, which is a combination of quinapril and hydrochlorothiazide; Atacand HCT, it's a combination of candesartan and hydrochlorothiazide. Avalide, which is a combination of hydrochlorothiazide and irbesartan. Diovan, HCT, a combination of valsartan and hydrochlorothiazide. Hyzar, a combination of losartan and hydrochlorothiazide. Indiride, a combination of hydrochlorothiazide and propranolol. Lexel, which is a combination of felodipine and enalapril. Lopressor, HCT, a combination of metoprolol and hydrochlorothiazine. Lotensin, HCT, a combination of benazepril and hydrochlorothiazide. Myocardial, HCT, a combination of telmisartan and hydrochlorothiazide. Monopril, HCT, a combination of fenizapril and hydrochlorothiazide. Prenzide, which is a combination of lisinopril and hydrochlorothiazide. Tarca, a combination of trindolapril and verapamil. Tecturna, HCT, which is a combination of aliskiren and hydrochlorothiazide. Tenoretic, which is a combination of atenolol, chlorthalidone. And lastly, Zestoretic, which is a combination of lisinopril and hydrochlorothiazide. Okay, now we'll move on to talk about drugs that are used to treat hyperlipidemia. Now, this condition encompasses both hypercholesterolemia and also hypertriglyceridemia. And this is one of several well-defined risk factors for atherosclerosis. Alright, now we'll talk a little bit more in depth about cholesterol. Now, cholesterol is produced by the liver, and a certain amount of cholesterol is needed by the body for production of certain hormones, or the production of bile, or as a component of the skin, and also in nerve fibers. So you do need some levels of cholesterol. However, excess dietary intake of cholesterol can cause elevated serum cholesterol level. And dietary sources of cholesterol include foods from animal sources such as meats, egg yolks, bacon, shrimp, cream, lard, and so on. Now, some patients develop an extremely high serum cholesterol level, not because of an excess dietary intake, but because of a genetic disorder, with too few receptors on the cell membranes for cholesterol to bind to. So the cholesterol levels in the blood remains high because they don't have anywhere to go. Triglycerides are produced by the liver and are used to make subcutaneous fat to help cushion and protect the body. However, excess dietary intake of non-animal fats can result in excessive storage of fats in the body and a high triglyceride level within the blood. And some common dietary sources of triglycerides include oils and margarines. Now, also of interest is that an excess of dietary intake of sugar is converted into triglycerides. And it's common for alcoholics to have an extremely elevated level of serum triglycerides. Now, alcoholic beverages contain no nutrients except sugar. So the large number of calories contained in alcoholic beverages gets converted into triglycerides. As she says, water and oil do not mix. Same thing with fats and lipids, cholesterol and triglycerides. They do not mix with the serum portion of the blood. So to be transported throughout the blood, cholesterol and triglycerides must bind to certain carrier proteins. These are called lipoproteins. And there are 3 different types of lipoproteins. They're classified by how dense they are. It's really in relation to how much lipid there is versus how much protein there is in that combination unit. The one that you want to have a lot of are the HDLs, the high-density lipoproteins. This is the good cholesterol. Now, these will carry cholesterol to the liver, where it is excreted in the bile. So this is the kind of cholesterol that you want. You want HDLs, because one of their functions is to go around the blood and kind of gobble up the bad cholesterol, which is the next kind, the low-density lipoprotein. In this combination, there's much more lipid than there is protein. So that's why they're classified as low density, because fat will float compared to the more dense protein. Now, low-density lipoproteins will carry cholesterol to the cells where it can be metabolized for energy. But because they are low density, they tend to float around within the blood, so they are able to be deposited on artery walls where they form arteriosclerotic plaques. This is why these are the bad cholesterols. And the third category, which is even worse than the low-density lipoproteins, are the very low-density lipoproteins, or VLDLs. In this combination, you have very little protein and a high amount of lipids. So the HDLs are good cholesterol, is what you want, and the LDLs are the bad cholesterol, is what you don't want. Alright, now we'll talk about some drugs that are used to treat hyperlipidemia. One type of drug is used to treat this condition are called bile acid sequestrant drugs. Now, cholesterol from the blood is used by the liver to produce bile. Now, bile is stored in the gallbladder until it's needed, and then is released into the gastrointestinal tract to digest dietary fats in the intestines. Most of the bile is reabsorbed from the intestine back into the blood and then reused by the liver. If serum cholesterol levels are too high, then this kind of drug is given. The way they act is they bind to bile, forming an insoluble complex that gets excreted into the feces. So the term sequestrant means to sequester the bile. It removes the bile from the blood. So because this bile is not being reabsorbed, the liver must draw cholesterol from the blood to produce a brand new supply of bile. So by doing so, this helps to lower the levels of cholesterol within the blood. Some examples of this category of drug: cholestyramine, also known as Questran or Prevolite; Colesevelam, sold under the trade name Welchol; and Cholestipol, which is sold under the trade name Colestid. Another category of drugs that's used to treat hyperlipidemia is called HMG-CoA reductase inhibitor drugs. Now, HMG-CoA is a much shortened version of the compound's chemical name and stands for hydroxymethylglutarol coenzyme A reductase inhibitor drugs. Now, HMG-CoA reductase is an enzyme that is important in the production of cholesterol. So these inhibitor drugs will block the action of HMG-CoA reductase. So by blocking cholesterol from being made, you will increase the level of high-density lipoproteins, which is the kind that you want. And this category of drugs is also known as statin drugs, because their generic drug names all end with the ending statin. And patients who are on this kind of drug are periodically tested for liver function abnormalities. Some examples of HMG-CoA reductase inhibitor drugs: atorvastatin, more commonly known by its trade name Lipitor; fluvastatin, also known by the trade name Luscol; lovastatin, sold under the trade name Mevacor; pitavastatin, known by the trade name Livalo; pravastatin, known by its trade name Provocol; rosuvastatin, known by the popular trade name Crestor; simvastatin, known by its trade name Zocor. Some other kinds of drugs that are used to treat hyperlipidemia or hypercholesterolemia: ezetimibe, also known by the trade name Zetia, and this acts in the wall of the small intestine to block cholesterol from being absorbed by the small intestine to get back into the blood. Niacin, known by the trade names Niacor or Niaspan, and this works to decrease levels of the VLDLs and the LDLs. A quick did you know? Oatmeal is very effective in lowering the cholesterol level of the blood. Now, the oat fiber within oatmeal binds to bile in the intestines, keeps it from being reabsorbed back into the blood. So this is the same exact action as a bile acid sequestrant prescription drug. It's like most of the other conditions we've talked about. It's very common to see a combination of drugs used to treat the condition. The same is the case for hyperlipidemia or hypercholesterolemia. So one possible combination that you would see is an HMG-CoA reductase inhibitor plus another drug. Some examples of this would be the drugs Advocor, which is a combination of lovastatin and niacin; Liptrazet, which is a combination of atorvastatin and also ezetimibe; Simcor, which is a combination of simvastatin and niacin; and Vitorin, which is a combination of simvastatin and ezetimibe. Now, some drugs that are used to treat hypercholesterolemia also have a therapeutic effect on lowering triglyceride level. And some examples of this would include atorvastatin, Lipitor, rosuvastatin or Crestor, and pitavastatin or Livalo. And there are some drugs that are used to treat hypertriglyceridemia, and these act by decreasing the production of very low density lipoproteins by the liver. And by doing so, this will lower the serum levels of triglyceride. And some drugs that fall under this category would be fenofibrate, also known by the trade names Trilipix or Tricor; gemfibrozil, also known by the name Lopid; icosapent, which is known by the trade name Vascepa. Now we'll move on to drugs that are used to treat CHF, congestive heart failure. Now, this condition occurs when the heart muscle is weakened, either because of disease or by a structural defect, such as a leaky valve, and then the heart is unable to adequately pump blood throughout the body. There are two different kinds of heart failure, either right-sided heart failure or left-sided heart failure. For right-sided heart failure, this causes a backup of the blood from the right ventricle back into the venous circulation. So this will produce an enlarged liver, distended veins within the neck, peripheral edema in the extremities. Because it's important to remember the cardiovascular system is one continuous circuit. If there's a blockage, the blood has to go somewhere. If it can't go forward, it's going to have to go backwards. So that's why you get the enlargement of the softer organs, such as the liver, the distension of the vessels within the neck, the edema within the extremities. The blood has to end up going somewhere. For left-sided heart failure, this causes a backup of blood from the left ventricle back into the pulmonary circulation. So this will produce a pulmonary edema within the lungs. So again, if the blood can't go forward, it's going to end up going backwards. All right, there are multiple kinds of drugs that are used to treat congestive heart failure. And these help the heart by making the heart beat slower or helping the heart to contract more efficiently. A common drug that's used for patients with congestive heart failure are diuretics. And diuretics will help the body excrete excess fluid found within edema in the urine, and also include excess sodium and excess water. So by doing so, you are lowering the level of blood volume, which means the heart doesn't have to work as hard to pump the blood throughout the body. Another type of drug that's given to treat CHF are digitalis drugs. And these make the heart pump slower, but much more strongly. So you're getting a more efficient use of each contraction of the heart. These are also known as cardiac glycoside drugs. And they're called that because they have a molecular structure or consist of chains of glucose molecules. Some examples of digitalis drugs that treat CHF: digoxin, also known by the trade names Digitec, Lenoxacaps, and Lenoxin. Okay, now we'll get a little bit more in depth about how digitalis drugs work. Digitalis drugs cause the release of acetylcholine, which is a neurotransmitter within the parasympathetic nervous system that depresses the sinoatrial node of the heart, the natural pacemaker that we have. So by slowing down the natural conduction of the heart, it will slow down the heart rate. So this action is known as a negative chronotropic effect. Now, digitalis drugs also inhibit the flow of positive sodium ions into the cell. Instead, positive calcium ions flow into the cell, and this results in a stronger, more forceful contraction of the myocardial cells. So this is known as a positive inotropic effect. So we have the heart beating slower, the negative chronotropic effect, combined with the positive inotropic effect, the heart beating more forcefully. Those two in combination with each other allow the heart to fill more completely with blood before the next contraction. So this is a very important therapeutic effect for patients with congestive heart failure. So it's beating at a slower rate, but it's allowing the heart to fill with more blood, and when it does contract, it contracts with much more force. Now, digitalis toxicity is a serious adverse effect. Nearly 1/3 of patients who take digitalis drugs develop symptoms of digitalis toxicity. It's because that these types of drugs have a very low therapeutic index. The margin between the therapeutic dose and a toxic dose is very, very small. And the fact that it has a very long half-life, which means that it will stick around in the body longer. And this is even more pronounced in patients who are elderly or who have a decreased kidney function, because it can't be metabolized and excreted at a normal rate. So symptoms of toxicity include a pulse rate that's below 60 beats per minute, confusion, restlessness, nausea, vomiting, diarrhea, hallucinations, and also seeing yellow-green halos around lights. So to prevent toxic effects, physicians periodically need to order blood tests or to monitor drug levels. And these tests are often referred to as DIG levels. Now, symptoms of toxicity may be treated in one of three ways. You can either decrease the dose of the digitalis drug, give the digitalis drug less frequently, or in severe cases, administer an antidote drug that helps to reverse the toxic effects of the digitalis drug. There are some drugs that are given for digitalis toxicity. An example of that would include digoxin immune fab, which is sold under the trade names Digifab or Digibind. And these are antibody drugs. These are administered intravenously, and the way they act is they bind with and activate digitalis within the blood. And this forms an antibody-antigen complex that is excreted within the urine. Another category of drug that's used to treat congestive heart failure are ACE inhibitor drugs. Now, ACE inhibitors are drugs that block the enzyme that converts angiotensin 1 into angiotensin 2, which is a very strong vasoconstrictor. So by blocking that conversion, this causes vasodilation. So this decreases the blood pressure against which the heart must pump, because you are lowering pulmonary vascular resistance. The other type of drug are angiotensin 2 receptor blocker drugs. And these work because they block the action of angiotensin 2. And by doing so, they allow the smooth muscle of the blood vessels to dilate, which will lead to a decrease in blood pressure, which allows the heart to pump more effectively with less resistance. There are two drugs that are specifically indicated for congestive heart failure that are classified as angiotensin II receptor blocker drugs, and those are candesartan, which is known by the trade name Atacand, valsartan, which is known by the name Diovan. Some other drugs that are used to treat congestive heart failure: metoprolol, known by the trade names Toprol or Lopressor. These are shown to decrease hospitalizations and deaths due to congestive heart failure. Carvedilol, also known by the trade name Coreg. Now, this drug will block alpha receptors and beta 1 and beta 2 receptors within the smooth muscle of blood vessels. And by doing so, this will lower the blood pressure against which the heart must pump. The drug Pleranon, also known by the trade name Inspira. This is an aldosterone receptor inhibitor drug, and it works by blocking the action of the hormone aldosterone. And this will lead to a decrease in blood pressure, which means the heart has less resistance to pump against. The drug Nasiratide, known by its trade name Natracor. This is a human B-type natriuretic peptide drug. Now, this drug will bind to receptors on the smooth muscle of arteries and veins, which will end up causing dilation. And this will decrease blood pressure and will offer less resistance that the heart has to pump against. This drug is actually manufactured from the bacterium E. coli using recombinant DNA technology. All right, now I'll talk about drugs that will treat angina pectoris. Now, angina pectoris occurs when the cells of the myocardium receive insufficient levels of oxygenated blood. And this occurs when the need for oxygen increases, such as during times of exercise and times of stress. And this can be caused by plaques within the coronary arteries that will occlude the flow of blood, or can be caused by spasms within the coronary arteries, or by vasoconstriction of the coronary arteries due to smoking. When it comes to the pain of angina pectoris, this denotes the cellular ischemia of the heart muscle. So angina pectoris is also known as ischemic chest pain. Now, at this point, cellular death of the heart muscle has not occurred. So at this point, all you're having is a decreased amount of blood flow. But if left untreated, this can progress to a cellular death, which leads to myocardial infarction, also known as a heart attack. Some common drugs are used to treat angina pectoris. Nitrate drugs. These work by dilating the coronary arteries, and by doing so, it will increase the flow of oxygenated blood to the heart muscle, the myocardium. It will also dilate the arteries and veins throughout the circulatory system. And we talk about dilating the vessels throughout the whole system. When you have dilated arteries, that will decrease the arterial blood pressure, which means the heart has less resistance to pump against. When you have dilated coronary arteries, this increases the flow of oxygenated blood to the heart muscle itself, and it decreases afterload. And afterload is another term for the ventricular pressure at the end of systole or contraction. And sometimes that's called ESP, ending systolic pressure. When it comes to dilating veins, this will reduce preload, and preload is the ending diastolic volume at the beginning of systole, or at the beginning of a contraction. And this will decrease the need for myocardium for oxygen. So there's less volume there present, the less of a need for oxygenated blood to be there. Some other examples of nitrate drugs to treat angina pectoris: amyl nitrate, isosorbide, known by the trade name Isordil, nitroglycerin, known by the names Nitrostat, Minitran, or Nitrodur. And nitroglycerin is the most frequently prescribed nitrate drug for this condition. Another type of drug that you can use to treat angina pectoris are beta blockers. And these act by decreasing the heart rate, or decrease the need of the myocardium for oxygen, which will decrease the level of angina pain. And only these beta blockers that are listed here are used to treat angina. Those include atenolol, metoprolol, nadolol, and propranolol. Now we'll do a focus on healthcare. When it comes to nitroglycerin drugs, they can be administered in several different ways. They can be put underneath the tongue, sublingually, as a tablet. They can be given translingually as a spray. They can be inhaled as a vapor through the nose. They can be given orally as a sustained release capsule or a tablet. They can be given transdermally as a patch, or even topically as an ointment. And this kind of drug would be measured in inches, depending on the size of the patch that's used. And they can also be given intravenously. But not every nitrate drug can be administered by every route. So according to the American Heart Association Advanced Cardiac Life Support Guidelines, IV nitroglycerin is the drug of choice for severe angina. And this has to be administered by a special tubing that is supplied by the drug company. Another class of drugs that's used to treat angina pectoris are calcium channel blocker drugs. Now, these are used in conjunction with nitrate drugs and also beta blockers. And these act by causing the smooth muscle in the coronary arteries to dilate. which will allow more blood to flow to the coronary arteries. Now, only these calcium channel blockers that are listed here are used to treat angina pectoris. Amlodipine, also known as Norvasc, diltiazem, also known by the name cardizem, nicardipine, also known as Cardine, nifedipine, also known by Procardia or Adalat, and Verapamil, also known as Covera HS or Calin. Some other drugs that are used to treat angina pectoris, anticoagulant drugs. These are used to prevent a blood clot that would cause a myocardial infarction. And some examples of these would include warfarin or thrombin inhibitor drugs or platelet aggregation inhibitor drugs. That would include a low-dose aspirin, 81 milligram dose of aspirin. All right, now we'll talk about drugs that are used to treat myocardial infarction, or MI. Now, a myocardial infarction is untreated myocardial cell ischemia that's associated with angina pectoris. And this may progress to myocardial cellular death. Now, once this death has occurred, the process can't be undone. Once that tissue is gone, it's gone. Now, drugs used to treat MI can limit the extent of the area of the dead tissue and can improve the survival rate following a myocardial infarction. Now, there are various different types of drugs that are used to treat MI. One type is a thrombolytic drug. And these are drugs that are used to break up clots. And by doing so, you would increase blood flow to the tissue. Other types of drugs used to treat myocardial infarctions are beta blockers, such as atenolol, metoprolol, propranolol, and timolol. You can also use ACE inhibitor drugs, such as captopril and lisinopril. You can also use angiotensin II receptor blocker drugs, such as valsartan. You can use platelet aggregation inhibitor drugs. These are used to keep blood clots from forming within a patient who has already had a myocardial infarction. And some examples of this kind of drug would be clopidogrel, also known by the name Plavix, and also the drug prasugrel. I now move into the drugs that are used to treat arrhythmias. Now, cardiac arrhythmias are caused by abnormalities of the conduction of the electrical impulse throughout the conduction system within the heart. Now, there are various different kinds of arrhythmias involving the atria and ventricles, and can be caused by disruptions within the conduction path, changes in normal period of time between each beat. Now, some common examples of arrhythmias: bradycardia, where you have an abnormally slow rate. You can have heart block, tachycardia, which is having an abnormally fast rate. Atrial flutter and fibrillation is where you have very rapid contractions of the atria that are not coordinated at all with the ventricles. You also have ventricular flutter and ventricular fibrillation. When it comes to flutter, that is a very rapid contraction of the ventricles. When it comes to fibrillation, this is an ineffective, extremely rapid twitching of the ventricles. You also have asystole, which is having no heart contraction at all. There are several different types of drugs used for arrhythmias. Drugs that would treat bradycardia. Bradycardia is a heart rate that's less than 60 beats per minute. And what happens here is the vagus nerve releases acetylcholine to keep the heart in a slow, normal rhythm. So a drug that could be given to help combat bradycardia is atropine. Atropine works by blocking acetylcholine receptors in the heart, so the heart rate increases. When it comes to heart block, this is where you have only some or none of the electrical impulse from the natural pacemaker, the sinoatrial node, are able to travel to the ventricles. So these signals are being blocked. That's why it's called heart block. A drug that could be given to treat this would be atropine also, or the drug isoproterenol, also known by its trade name Isoprel. When it comes to treating ventricular tachycardia, or VTAC as it's called, it's having a fast but a regular heart rate of up to 200 beats per minute. And drugs you've used to treat this condition are beta blockers. These act by blocking the beta receptors in the heart from being able to respond to epinephrine, so it can't get any faster. Some examples of this kind of drug would be acebutolol, or Sectrel, esmolol, Brevibloc, and Sotalol, also known as Betapace. You can also use calcium channel blocker drugs for ventricular tachycardia, and these act by slowing the movement of calcium in and out of the sinoatrial node. Some drugs that would fall under this category would be diltiazem, also known as cardizem, verapamil, also known as Calin or Covera HS. Other types of antiarrhythmic drugs: adenosine, also known by the trade name Adenocard; amiodarone, also known by the trade name Cordarone; disopyramide, also known by the name Norpace; and flecainide, also known by the name Tambicor. The other examples: mexilotine, also known by the trade name Mexatil; procainamide, known by the name Pronestil; propafenone, Rhythmol, and quinidine. Types of drugs that are used to treat atrial flutter and atrial fibrillation: you can use beta blockers, because beta blockers will block epinephrine from reaching the stimulating beta receptors within the heart. So this will slow down the amount of fibrillation and the amount of flutter. And some examples of this kind of drug: propranolol, also known as Inderol; sotalol, also known as Betapace. You can also use calcium channel blocker drugs for atrial flutter or atrial fibrillation. And these act by slowing the movement of calcium both in and out of the sinoatrial node. And some examples here: diltiazem, also known as cardizem; and verapamil, also known as Calin or Covera HS. Some other drugs that could be used to treat atrial flutter and fibrillation: digoxin, also known by the name of Lanoxin; difetilide, also known by the name Tocopsin; dronedarone, also known by the name Multac; flecainide, known by the name Tambicor; albuterolide, known by the name Corvert; and propafenone, known by the name Rhythmol. When it comes to ventricular fibrillation, very fast but very uncoordinated quivering of the heart. This is a life-threatening emergency because the heart is unable to pump blood at all. So this is incredibly serious, incredibly life-threatening. And the drug of choice in this condition would be lidocaine, also known as xylocaine. Now this drug is used to treat ventricular fibrillation, but it has no effect if the heart has already stopped beating, if it's already in arrest. It will have no impact on the heart at that point. So it's only used to treat fibrillation. Okay, and that brings us to the end of Chapter 11 on cardiovascular drugs. We will continue our video series on pharmacology with our next video on Chapter number 12, hematologic drugs.